Today I'm going to cover 7 missed symptoms of PTSD and also reasons why you may have PTSD and not know it. Hey veterans, it's Kelly here at VA Claims Insider. And when you think of post-traumatic stress disorder, PTSD, you may think of flashbacks, unsettling memories, or negative thoughts. But did you know that there are some easily missed signs of PTSD, making it harder to diagnose? What makes a diagnosis even harder is there's no specific test for PTSD. You can't swab your mouth to get a diagnosis. There's no blood test that can determine evidence of PTSD. So understanding missed signs or hidden signs is important in determining whether you have PTSD. You might want to grab a pen and paper to jot down some important phone numbers that I'm going to mention in the video. You can pause. I'll wait. Before we begin, it's important to understand that resources are available. To confidentially connect with a Veterans Crisis Line responder anytime, day or night, dial 988, then select 1, start a confidential chat online via va.gov, or text 838-255. It's also vital to schedule an appointment with your doctor to help identify your individual needs. Let's get started with 7 missed signs of PTSD. Number 1 is memory problems. PTSD can affect your memory in several ways. For example, you may experience gaps in memories surrounding the trauma or have difficulty concentrating or forming new memories due to intrusive thoughts or flashbacks. In addition, veterans with PTSD might struggle with short-term memory, such as forgetting appointments, losing track of personal items, or having difficulty concentrating on tasks. Next is persistent feelings of guilt and shame. If you have intense feelings of guilt or shame, especially if they seem out of proportion to the situation, they may be misinterpreted as low self-esteem or depression when it could be PTSD. For example, if you were in an accident, you may blame yourself for what happened. Guilt can be debilitating and greatly affect your quality of life. Next is exaggerated startle response. If you've ever found yourself jumping at sudden noises or flinching when someone comes in a room, you may have an exaggerated startle response. Unfortunately, these types of responses can lead to unnecessary stress and anxiety. For example, a person with PTSD may constantly scan their environment for danger, even in situations without any. Next is avoidance of specific places or activities. You may develop avoidance behaviors, including avoiding places or activities that remind you of the trauma. However, these can be subtle and not immediately linked to the traumatic event you experienced. Next is difficulty maintaining close relationships and withdrawal. Research shows that symptoms of numbing and withdrawal are the most difficult symptoms to identify, particularly for spouses. You may notice you feel detached or emotionally unavailable, which is often mistaken for depression or lack of interest. Next on the list is emotional numbness and an inability to experience joy. Frequently, someone with PTSD may seem detached or emotionally unavailable, which can be mistaken for depression or lack of interest. For example, you may lose interest in your favorite hobbies or spending time with loved ones. You may also have increased irritability or an unexpected anger outburst that you attribute to stress. Lastly are physical symptoms. Chronic pain, headaches, stomach issues, or other unexplained physical symptoms can be linked to stress or other physical health conditions rather than PTSD. It's important to address aches and pains because treatment can help decrease the severity of your physical symptoms. So don't ignore unexplained pain because it could be a sign of PTSD. Keep in mind this isn't a complete list of PTSD symptoms, and it's always best to speak with your doctor if you think you may have PTSD. Next, I'm going to touch on the question, can you be living with PTSD and not know it? The short answer is yes. But I'm going to go over a couple examples of how you could be living with PTSD and not know it. Number 1, you didn't experience combat. You don't have to be on the front lines to experience PTSD. Let me say that again. You can have PTSD without going to war. Any traumatic event is considered a stressor, and that includes losing a fellow service member to suicide, being in a car accident, being sexually or physically assaulted. Next is you don't want to be perceived as weak. You're not. The stigma surrounding mental health conditions is illogical and unproductive and could keep you from recognizing and getting help for your PTSD. Next is you didn't have symptoms after the traumatic event. While many people develop PTSD symptoms within 3 months of the stressor, others may not develop them for years. For example, one study showed that World War II veterans did not manifest PTSD for 30 years after their combat trauma. Next is you can't identify a stressor. You might find yourself experiencing all kinds of symptoms, but not being able to put your finger on exactly what's going on. PTSD shares symptoms with depression, social anxiety, and OCD. However, PTSD is a distinct diagnosis that developed in reaction to a traumatic event or stressor. Lastly is perhaps you're masking the symptoms. It's very common for people with PTSD to cope by drinking. For example, men with PTSD are 2 times more likely to abuse alcohol. Before I go, I want to remind you there are resources available if you have or think you may have PTSD. I'm going to put up the Veterans Crisis Line information again on the screen in case you didn't have a chance to jot it down. And remember, it's best to make an appointment with your healthcare provider who can help guide you to the appropriate help and treatment. Please remember that you matter and help is a click away.